Hello and welcome. Thanks everybody for joining us. My name is Caroline Pearson. I'm the Executive Director of the Pearson Health Technology Institute, and I am so excited to share with you today our brand new playbook on performance-based contracting. You're going to find a link to the playbook in the chat, and so I encourage you to open it and begin to explore and click around and familiarize yourself with it. But first, let me tell you a bit about what our plan is for today. Many of you are accustomed to seeing me on regular PHTI webinars, but I assure you there will be no stoplight graphics on this webinar. Today, I really want to tell you a bit about how we got started on our performance-based contracting work and why we decided to initiate this project. We're going to talk about some of the impact that we got directly from purchasers about their needs for assistance around performance-based contracting. And then we're going to do a live demonstration of these tools, which are very rich content tools that are informative and have a lot of information to share. So let's get started. If you have questions during today's webinar, please do drop them in the chat and we will attempt to follow up with you afterwards. And I can anticipate your first question and assure you that this webinar is being recorded and it will be posted on our website next week. So as you know, over the last couple of years in our work evaluating digital health solutions, we continue to hear from health plans and employers with a similar question. How do we know if we're getting what we're paying for? And how can we be confident that the solutions that we're integrating into our health benefits are really delivering changes in health outcomes for our members? And at PHTI, we believe that performance-based contracts are an important step forward to begin to tie payments directly to outcomes as the digital health industry has matured and has more evidence to support its impact on families and members. But we also know that there can be real challenges in adopting PBCs, and so that's why we put together this toolkit. So last year, we conducted a survey of purchasers, which we do on an annual basis. And you can see one of the results here, which is that purchasers consistently tell us that they want to see more value in their payment models in their contracts, but that this remains really difficult. Purchasers are generally somewhat overwhelmed by the number of digital health vendors and their options, and they really want to ensure that they're getting what they're paying for as they are thinking about some of their contracting models. So we said, hey, there's a collective need here, and we could create some resources and tools to support them. And if we go to the next slide, one of the things that you'll see is while the demand for performance-based contracts among both health plans and employers is very high, there are concerns about the practicality of implementing these resources at scale. And so you see on the left, particularly for that purple bar of employers, you consistently hear that interest in performance-based contracts is high, but I have a limited benefits team. I don't have the time and the actuarial and data resources to be negotiating and adjudicating all of these contracts. And so that is really a top concern. And one of our goals in creating these resources is to not only level up the entire field about what goes into these contracts, but hopefully to create some standard definitions and starting points for those negotiations that can move things forward more quickly and easily with limited staff time and limited data resources. So I'm going to show you all of those pieces of information in a little bit. But before we get into that, I would really like to help introduce a panel who's going to tell us a little bit about why this work is so important and why we set out to do it. And to ground that conversation, I'm going to be joined by my colleague, Meg Barron, who leads outreach and engagement for PHTI and who really was the champion of this work and has talked to many, many people throughout this process and can share some of her insights, as well as Darcy Sementi, who is the health benefits manager at State Farm and has lots of wonderful advice that we always appreciate and that she'll share with you today. We had planned to include Mark Griffin, who is the Executive Vice President and Chief Human Resources Officer at BJ's Wholesale Club. Unfortunately, he's unwell today and isn't able to join us, but we wish him a speedy recovery. So let's turn to our panel. Meg and Darcy, great to see you. Thank you for being here. Darcy, I'm going to jump right in with you. As a benefits leader, I hear from you all the time how committed you are to the health and well-being of your employees and their families. And one of the things that I think we heard throughout this project was, frustration with vendors who are focused on satisfaction surveys or enrollment metrics as a definition of success. And we sort of heard, no, what we care about is health. How do we drive towards health? So, can you tell me a little bit about sort of how you think about digital health solutions really driving towards better health outcomes in your population?
First, thank you very much, Caroline, for inviting me to be a part of the panel. I am a huge fan of the work of PHTI and appreciated the opportunity to have a voice in the process that your staff worked through to get to this performance-based contracting toolkit. When I first came to State Farm, which is almost 7 years ago, we clearly know what conditions are driving our healthcare costs. But we were, forever looking for solutions, not only because they're driving the cost of our health plan, but they truly impact our employees. They impact how they show up to work every day, and how they show up to work impacts our customers. And so it's this combination of not only managing our cost, which every benefit leader, every health plan is struggling with, but also how is it that we truly know that our employees are benefiting from the solutions and they're getting the outcomes that we want, not just about the cost, but also about how is it that we can help them be a better human being, a better employee, a better mother, a better, contributor to society. It's so far reaching the impact of your health.
That's wonderful. And maybe, Darcy, sometimes I go out and people say, I don't know that digital tools are so central to healthcare. So, when you think about digital health solutions, how are you seeing them add to your benefit? What are you generally trying to accomplish as you're looking at or integrating digital health tools?
So I think it's really, the tools don't mean anything if they're not used. And so that's one of the things that I think that as we looked at this evolution of how we hold accountability, we were so focused on engagement, because if it's a tool that's not used, it doesn't matter. Then what defines engagement became a challenge, because we would find that someone just would accidentally click on an email and they're like, oh yeah, they engaged with our solution. So I think that there's this balance of not only knowing that it's being, that people are using the tool, but then how is it that that tool is truly driving the outcomes that we want? And that is, I think, that the struggle that we've dealt with for so long is it's more than just engagement, but then also what are the outcomes and how can you articulate those and how can you measure them? If you're expecting someone to lose weight, but you can't tell me how much they weigh, how do I know whether you're successful? So, I mean, then you get into this data problem of where does the data come from? Is it self-reported? Is it from clinical? Do we have access to labs? And so it was just this cycle of it was, I guess it was maybe peeling away the layers of an onion. And once we think that we would have one piece solved, what did we know? But we're missing another piece to get to what we really wanted. And every solution is a little bit different in terms of what we're trying to accomplish and what those outcomes are. So it's never just a single question you have to ask or a single data point that you're seeking, but you have to be forever asking questions and being curious and questioning, is it really getting to where you want? And what's the impact that it's having on your workforce?
I'd love to double click on some of the points you raised around data and engagement, but maybe before we get there, Meg, Darcy just raised a lot of factors that she's thinking about in contracting, and it sounds, it sounds complicated. So in your conversations, I think you talked to so many stakeholders. What were some of the challenges that you consistently heard as people were thinking about performance-based contracts?
Yeah, absolutely. Darcy, just again, a huge thank you for your contributions to this work and to, the more than 50 individuals that provided insights into it. And Darcy's spot on. I mean, first, the good news from our numerous discussions with both purchasers and vendors, there is interest in improving these contracts from both sides of the market, right? But historically, purchasers have reimbursed digital health vendors on really the basis of the number of program participants. So think more per member or user per month fees, versus under a PBC, some or all of the payments to vendors are contingent upon like pre-specified outcomes such as clinical improvements or engagement rates or cost savings. And that's where there's been a lot of friction in attempting to operationalize performance-based contracts. First, what we often hear is that it's difficult for employers and purchasers to validate the claims that their digital health partners are providing to them, often because internally they have smaller team sizes and resourcing constraints. And this is especially true for smaller to mid-sized employers that we talked with. But it's also difficult because a lot becomes lost in translation. And Darcy, you touched on this with different definitions that purchasers and vendors are using, meaning if the specifics aren't defined clearly up front, employers often don't end up even receiving the data that they actually need to validate it if it's working. But even more so, they don't then know the context, right? And I'll give you an example of that. A global technology company that we interviewed, they actually went ahead and invested in data infrastructure so that they could better evaluate and negotiate and manage the digital health contracts that they have. And this is on top of everything else that, they're juggling at one time. But now, before they implement anything new, they conduct a readiness assessment to define realistic and really data-driven performance guarantees. And then post-launch, they also now monitor these through really more of a centralized data warehouse so that they can validate ROI in as real time as possible and then adjust the contract terms accordingly for that. So just one quick instance of that, that might mean they end up altering the communication limits or some administrative terms that they've set. And these are all things that we felt were important to be able to outline in both the playbook and the toolkits that we developed.
Thanks, Meg. And, Darcy, maybe tell me a little bit about your experience with performance-based contracts historically. Have you been able to accomplish them? And, how hard has that been?
It's interesting because I feel the vendors want to be good partners. They want to have outcomes and they want to be able to prove that their solution is the best. And so we actually have a couple of instances where a vendor stepped up to the plate. So we had an issue with one particular vendor where we were being charged as soon as someone signed up, but they didn't take that next action. And I came to the table with that vendor and I said, listen, we're willing to be a part of the solution, like hold a member accountable, but we don't want to see this waste. And so I think part of it is just having transparent conversations and looking at things for win-win solutions. There's a cost of doing business that these vendors have, and I don't want to ignore that. And I know that, we're making an investment when we do that. But at the end of the day, there also has to be accountability in looking at outcomes. And so in that particular vendor's case, we came to a solution that they said, listen, we're not going to charge you until they actually take that step. Signing up on the website is not enough for us to charge you. And then we ended up breaking it into milestones that we felt that we were reimbursing them as soon as they truly made an investment in some of our employees. And then they were very adamant about their solution and the results that they were going to deliver, that they actually then recommended the milestone-based reimbursement that came after it. And in another scenario where we had a vendor that there was issues with the data, they ultimately did not have the data to report on the outcomes that they wanted. And we invested a lot of time. We didn't come to a solution. But at the end of the day, you have to sit down and have difficult conversations. You have to be curious and you have to ask a lot of questions because the vendors, they want to deliver results as well. I believe that people are well-intended and they know for the longevity of their solutions. And if they want it to be viable, they're going to be asked these tough questions and they need to come together and be a partner to find these solutions.
Yeah, I love that point. And, Meg, you mentioned that you spoke to over 50 people or groups during this process. They weren't all purchasers, right? The vendors were part of this process. Tell me what you heard.
Yeah, so very much so. And, we thought that was such a critical aspect of this work is, Darcy, to your point, these are mutual agreements, right? And there needs to be sustainability and kind of alignment as early stage as possible. And I think on just drawing on purchaser feedback, this is why we need more standardization of what good could and should look like, and to create that as more of a North Star. And we felt the need, based on all the discussions we had with, again, purchasers, but also vendors, to be able to share that and elevate that so that others can better understand, oh, geez, I could be nudging on this side a bit, right? Or I shouldn't just throw the baby out with the bathwater here. There's ways for me to improve this. I just need to be asking for more specificity and making sure that that translates into the actual contract or agreement so that on an ongoing basis, you can have checks and balances along the way, like any good relationship.
Can I add one more example?
Please.
So there's another performance-based contract that we went into that had milestones. And we actually ran into when they were about to charge us for a new milestone, we were like, this doesn't look right. Like we're pretty sure based upon experience of our staff that we know that there's something wrong with this. And even after we thought we had the right milestones in place, we realized we had not accurately captured how we needed to have it reported in some guidepost around it. And that was an example where the vendor came back and they're like, you're right. This isn't correct. We need to revisit that. And they were even willing to go back and reopen our agreement that we sat down and worked through those details. But we had to look at the data, we had to have some examples, and we had to have that dialogue. It's an iterative process that you have to continually keep learning from what it is. And sometimes you just have to get into the weeds of it because all of the conversations you have may not fully reflect some of the reality when data and other information starts flowing through is the other big lesson that I think payers need to hear.
Yeah. It strikes me that this is really about, being a smarter payer, looking thoughtfully at the data. I mean, I hear so much reflection and iteration in what you're saying, and it's really like leveling up the whole field of how do we think about, smart design for benefits. Meg, the report mentions clawbacks as kind of one of the ways that performance guarantees or clawbacks have been done previously. And it suggested that you heard a lot of concern about clawbacks. So I guess to either of you, I'd love to understand, why has that not historically been a good model for contracting?
Well, I can start, and Darcy, please jump in from an on-the-ground perspective. But, we've heard just again historically that this has been somewhat the norm. But we also heard that historically, there's never been a clawback that hasn't been contentious in some way. So Darcy, to all the points you just made of this is a relationship, this is a partnership, right? You don't want to enter into anything knowing you're going to have these very sticky conversations when up front, despite it being more work and a bit more laborious, it's well worth it in the long run to make sure you're as aligned as possible about the specifics of what does success look like to you, and then kind of feasibility testing with the companies and with the vendors to align on expectations and to make sure, again, that gets translated appropriately into performance-based contracts. But I'd love your take, Darcy, on what you've experienced on the ground.
Yeah, I completely agree. No one wants to actually have to play the callback. Like, we want results. We want outcomes. We're not looking at getting that money back. And then even when there were issues, it came back to data and reporting and those conversations around what they were looking at and if we agreed to where that came from. And honestly, they were never very well defined. Like, it was still a struggle with what the language was in terms of what was going to result in that clawback. So they're imperfect. They're imperfect. And the other thing, I mean, we deal with cash flow. We paid that invoice after the fact, getting it back relative to what we're doing with the expenses that flow through our health plan. Then are they actually meaningful? Like, is it making even a bit of a difference in terms of the time that we invest trying to figure out and go through imperfect reporting on what they said they were going to do? And a lot of them weren't even meaningful. They weren't necessarily creating any pain maybe for those paying them, and they weren't really providing any benefit in terms of the reimbursement that come back to us in the whole scheme of what we're doing. And so, like, how is it that you find something that's more meaningful? Because ultimately, we need to save the dollars up front, and we need to know that the dollars up front that we're investing is something that is going to make a difference.
That's great. Darcy, do you feel like as you've been doing more of these kind of contracts tied to outcomes, is it building confidence about some of these tools within your organization? Like, is it actually a self-enforcing or reinforcing process?
Yeah, it is. I can think of one in particular where I know, like, it's a huge expense to the company. And so we never lose sight of that expense. But the one grace I have when I go to leadership is to actually show them the outcomes in this one particular milestone. And the fact that I can, with great confidence, report that it has been effective and it's having a meaningful difference in people's lives, that's exactly what we're hoping to achieve through these. And so it, I guess it maybe puts a little sugar on the medicine and makes it just a little bit easier to swallow when you have a lot more confidence. Because the worst thing ever was always when vendors were talking about avoidable future or avoiding future cost, right? The thing that no one can measure. And how do you go to a CFO and talk about that we're avoiding this expense in the future when you're still looking at double-digit medical trends? Like, yeah, explain that to me now. And so absent having any of those hard dollar savings and that type of impact, when you can truly go and show these health outcomes that have been defined, well documented, and well reported, there is such more confidence in talking to leadership about the investment that we are making in our employees.
Wonderful. Meg, obviously Darcy is a benefits rock star and has been leading the way. But I know that not every company has as many resources and as much experience as what we have heard Darcy describe. How do you see the role of this toolkit potentially helping other companies in terms of standardized benchmarks and definitions? Like, how does that work?
Yeah, absolutely. I mean, one of the biggest takeaways for me from doing the 50 plus interviews that we did, right, with both purchasers and vendors and others in market was largely from the purchasers who we had already heard in that purchaser survey that Caroline alluded to, who said they want to move towards performance-based contracts. But back to things getting lost in translation or the difficulty to be able to operational elements of that, like Darcy mentioned, it's the biggest point we heard was, man, I didn't know I could ask for this, right? Or I didn't know other people were already doing this or having this instituted into our agreements or into their contracts. So I think that really helps to move the needle on both fronts for both purchasers, employers, right, inclusive of that, but as well as for companies to get to additional standardization of back to this is what good should look like and how do we raise the bar for everyone involved. And Darcy, to your point, mostly for your employees and mostly for your patients who you want to be utilizing these tools and solutions to improve their health at the end of the day.
That's fantastic. Darcy, if you had one piece of advice for other benefits leaders in terms of how they can improve their contracting, what would it be?
You cannot be afraid to ask questions. Like I feel like the success that I've had has been the result of me and my team sitting around and looking at the data. And the fact that there's no stupid questions, and if it's not being explained to you to a point that you fully understand it and that you're comfortable explaining to your leader, then you need to keep diving in and asking more questions. Be curious and hold vendors accountable. And just remember, look for common goals. The vendors want to be successful just the same as we want to see these outcomes for our employees. And I just think you have to continue to be curious. You have to continue to look at the data. And it's not just a one and done. Even when we get these pieces in place, like I mentioned earlier, we found that we missed on one of the milestones and we have to go back. So I think it's something that you have to continue to stay engaged with, and you have to continue to watch as things continue to evolve.
Well, Darcy, thank you so much for everything that you are doing and for being such a thoughtful leader in this space. And we really appreciate you joining us and sharing your insights both on the webinar, but really throughout the development of the playbook. So thank you. And Meg, thank you for your fearless leadership on this project. I am so excited for it to be launched into the world and hopefully help others. And so thank you both for joining me today.
Thank you.
Thank you. It was a pleasure.
Wonderful. Okay, well, without any further ado, this is like the big reveal of these actual tools. So I'm super excited to turn to the playbook and begin to talk you through what you can see there. And I do hope that you will all visit the website and explore more on your own. So first, we're going to talk through the playbook, which is effectively the report. As we have mentioned, we worked with more than 50 stakeholders that included employers and health plans, of course, but also digital health vendors, brokers, consultants, data companies. We got a lot of input, and that really guided what you see here, which is meant to be a resource for people that want to learn more, that want to improve their contracting, and that want to execute more performance-based contracts that really drive not only better health outcomes and potentially savings, but also better evidence and data for the field. And so there is a rich set of information here to help you investigate and understand how to do this in your own organization, regardless of whether you have extensive in-house analytics support or not, and really to move us forward. One of the things that I'll highlight is how we sort of think about this evolution that you heard the team describe. So one of the graphics that I love is this one from the report, where you see that historically, mesh of the contracting for digital health solutions has really been on the left-hand side, really in these sort of per member per month or per engaged member per month models. And that made a lot of sense as we were focused on just getting enrollees to interact and to participate and adopt digital health solutions, and making sure that we could get those companies to really keep those members engaged over a period of time. But as we have built the evidence base and we begin to raise the bar, we want to see more introduction of clinical outcomes here in this middle section. And that doesn't mean that you have to forego access, right? We certainly want to make sure, if you think about something like a mental health intervention, it is incredibly important that we give vendor partners incentives to expand access and enroll people who would benefit from digital mental health solutions. So, those green enrollment-based metrics remain very central to the contract, but we also want to make sure that those solutions are delivering clinical benefits in the form of reduced symptoms of anxiety and depression. And that's going to be that turquoise section, really focusing on how do we have measurable clinical outcomes as part of a performance-based system or performance payment. And then on the right-hand side, and this is, just starting for some companies and some solutions, you begin to see the introduction of not only clinical outcomes, but also financial and ROI metrics. And there's many ways that can be done. But, we see an increasing number of solutions that are not only delivering clinical benefits to members, but that can really begin to prove that their management of both patients' symptoms and patients' healthcare utilization result in reduced spending for the payers. And so this final bar, where you've got a combination of enrollment, clinical outcomes, and financial metrics, is really going to be kind of the gold star of most rigorous contracts. So one of the other things that the Playbook really does is try to talk through what are all of the decisions that a purchaser and a vendor are going to need to negotiate as they are thinking about initiating new contracts. And so here you can see kind of the 7 key components of contracting decisions that are featured in this report. And as I said, there's lots more detail on each of these within the Playbook. But it begins first with, sort of what is our payment model? How are we combining clinical outcomes with an enrollment or a per member per month basis? Some contracts include shared savings models, and so all of those options are laid out and described in the Playbook. Then there's the really critical second row of defining outcomes measures. You heard Darcy describe that we do not want to be debating the attainment of clinical outcome targets on the back end. And so the best thing to do is really be very clear in the upfront negotiation about the eligible population. So who counts when we're looking at clinical outcomes? The engagement criteria. What is meaningful engagement? Again, as Darcy teed up, it's not just, did I sign up for the app or did I have my first appointment, but did I sustain meaningful engagement over some period of time? And let's agree on what that's going to be before we begin measurement. And then fourth, and of course, importantly, is what is the performance metric that we're going to look at? For instance, are we going to measure hemoglobin A1C if we're looking at a diabetes solution, an improvement in hemoglobin A1C? And then the third category is really those operational components to say that this is the business of how the interaction is going to work. So how will you engage my members? What kinds of data sharing do we expect mutually between both the purchaser to the vendor and then back again to the purchaser? And then how are we going to, at what cadence are we going to adjudicate and renegotiate our contracts? So at this point, I want to introduce for you some of these actual toolkits. And I am going to show you, let me first show you that we have 4 toolkits up right now. So in addition to the playbook, we have basically specific interactive guides for the first 4 PHTI report areas that we have published. So you've got diabetes, hypertension, musculoskeletal care, and depression and anxiety. And each of these toolkits is going to be a how-to guide to negotiating specifically for these condition areas. I'm going to show you one of them in hypertension, but it really is going to detail suggested inputs for the contract. But it's going to then let you make adjustments and design your own approach. And then following that, we are going to begin to release more toolkits with each of the PHTI assessments that come out. So you can expect more from us in the future. And I think we've already gotten a lot of requests coming in of other condition areas that people think would be valuable. And we really appreciate that feedback. So here you can see the landing page for the performance-based contracting toolkit playbook as we sent out. And I'm not going to scroll through this whole thing, but you've got sort of navigation through the sections up front. I will show you those key contracting decisions. So we mentioned the 7 key contracting decisions. And if you go down here, there's full sections that describe each of those and really help you level up your understanding, skills, recommendations. And importantly, we have a lot of case studies of sort of best practices. You heard from Darcy at State Farm. We had many others who shared with us how they have improved their own internal processes for creating these contracts. And those are featured throughout the playbook. If we come back up to the top and several places throughout, I'm going to jump us over to the interactive contracting toolkits. As you saw, this is where we have the 4 condition areas. And I'm going to walk you through hypertension as our example today. So here we are at the front of the toolkit. And all of this information, I'll just point out, the first thing you can do is decide to download the toolkit. So if you don't want to walk through the interactive, you can download it. And we've got a beautiful PDF that you can share with your colleagues with all of the information we're about to review. This gives you a little bit of an introduction about what the purpose of each of these toolkits are. And let me just highlight that these tools are not meant to build legally binding contracts. Both vendors and purchasers are going to need to work with their own legal teams to create contracting language. This is really about each of the inputs or decisions that are going to need to go into those contracts. And they're really based on recommendations from the detailed assessment reports and all of the evidence reviews that PHTI has done over the last 2 years. And so we really recommend you use these as toolkits. I will also just flag that as I am clicking through this, as you can do, you'll be able to export your decisions at the end, but none of the responses or data that's being put into the website is being saved or collected in any way. So this is, publicly available, but your selections are private to you. Okay, let's get started. So as we dive in, we're going to start with the all-important payment models. And as we mentioned, there's going to be a little bit of an explanation at the beginning. And here we're going to choose between our per engaged member per month, performance payment, or shared savings. So we can make an adjustment. I'm going to choose a 50-50 split between PEPM and performance payment. And I'll point out that throughout the tool, you're going to see these little circles with the eyes that pop up and can define terms or can give you little information about your selection. You're also going to see tips here that can help you understand some of the context around how this would be implemented. And then we can click to our next. So now we're going to enter the second section on outcome measures. And as we teed up, this is a really important section because this is how two partners in a negotiation are really going to define the numerator and the denominator for their evaluation. So we're going to have lots of inputs, but this is how you're going to end up calculating the information on the back end about your contract. So first, we need to decide the eligible population. Now, this is really important because for some solutions, we want to cast a very broad net and have a very extensive marketing campaign and broad set of enrollment into tools. But in others, we may want to really target solutions to a specific subset of a population based on stronger clinical criteria. And this is something that we've seen in many of our PHTI assessments, which is when solutions are deployed to a broad population, they are sometimes not as clinically effective on outcomes. And if we can begin to deploy them in a more limited, focused way to certain people, we get better outcomes and better performance writ large. So I'm actually going to select here a subset of patients, and we're going to choose just folks with higher blood pressure levels to enroll in my hypothetical hypertension contract. Now, again, this is the hypertension toolkit. Each of these exclusion criteria are going to be custom designed for specific condition areas based as appropriate. And obviously, you can adjust or modify as you see fit. Our next step is going to be looking at engagement criteria. And this is something that you heard Darcy speak about so eloquently, which is it is really important not just that we have a simple metric for instance, the member completing the onboarding or an initial visit, but we hear that most employers and payers really want to see a sustained and meaningful level of engagement. So we have multiple criteria that you might want to set here. Not just the starting connection, but for hypertension, we want to make sure, of course, that we have a first visit and that member is going to submit a blood pressure reading within a certain number of days so that we've got some baseline data about where they're starting out. On top of that, we want to make sure that there are a certain number of visits or interactions that the person is having over a sustained period of time. Now, our PHTI report found that if we're looking to see initial changes in blood pressure through digital solutions, we generally begin to see that within 3 months. So they may not be all the way to blood pressure control, but you can see improvements within 3 months. And so in this case, PHTI has pre-populated suggested cadences for both duration and transactions. But again, you can adjust that. So I'm going to go ahead and say I want to see 4 transactions over, or maybe I'm going to do 6. We're going to do 2 transactions a month over 3 months. Next, we're going to go to the performance metrics. And this is really where we start to get into clinical outcomes. Obviously, this is a huge focus of the clinical assessments that PHTI has been putting forward. And we consistently hear that these clinical components are what many employers have struggled with. So while our health plan colleagues have big clinical and medical affairs teams that provide a lot of input, many employer benefits teams do not have clinicians on staff. And so we have really tried to put forward very specific recommendations about how you would select and define a meaningful clinical outcome for each of these toolkits. So in this case, with hypertension, we have two options. We can either select the HEDIS-defined NCQA HEDIS-defined blood pressure control metric, which is effectively going to measure what proportion of patients that are enrolled in the solution achieve blood pressure control. Or we can look at changes in systolic blood pressure over time, which is something that we saw measured in a great number of the studies in our assessment. And you would likely put a minimum amount of systolic blood pressure improvement that you would want to see. I'm going to stick with just a blood pressure control outcome, but we also know, for instance, in hypertension, that medication adherence is very important and highly predictive of people improving blood pressure control. And so you might want to put an additional or a second performance-based outcome tied to medication adherence. So the next section that we click through is really tied to program tenure. And this is a tricky one because this is different from enrollment or engagement, right? We want members to come in and be engaged for a period of time. But then as we are regularly looking at the measurement of the outcomes, we certainly need to agree that we have enough time in the retrospective data for that member to have achieved the outcome. So in the case of hypertension, you see this here. Many of the digital hypertension solutions that we looked at were able to deliver blood pressure control or meaningful improvements in systolic blood pressure within 6 months. And so again, we have pre-populated a suggested 6-month starting point here. That's totally available for people to adjust as they see appropriate. But the goal of this tool is to give both partners in a negotiation a starting point for their conversation. So if we have all of these different decisions that we need to negotiate, maybe there are 3 that we can sort of agree to use the PHTI recommended values, and that just makes the process easier top to bottom. Next, we're going to look at engagement approach. So we're moving here into the sort of business portions of the contract that I mentioned before. And these are really important in terms of agreeing how a purchaser and their vendor partner are going to operate together. So you're going to see things here about governance, about the desire to review and approve marketing materials, about the frequency with which materials might be updated. How is outreach going to happen? This is something that comes up a lot in terms of hitting enrollment targets, right? How are we identifying eligible members, and how are we going to be ensuring that they get outreach at a reasonable cadence but are not an overwhelming one? And then any other things around compliance and member experience reporting. Next, we are going to be looking at data sharing. And you heard this come up a lot in our dialogue about how are we going to make sure that we have the data sharing that we need, both from the employer or the payer to the vendor. I need to be able to understand who is eligible for hypertension intervention. How are we going to identify them? And from that vendor back to the purchaser, when you say, I want to be able to see real information about those blood pressure improvements at a granular level, both to inform my overall benefit management, but also to determine whether we are succeeding in our contract. So here you're going to see some specifics that you can select about, do I want lab results? Maybe I don't need lab results, but I definitely want to know about any utilization. And I will highlight here, this is a required field, which is this data going to be identified or de-identified? And that's something that's very important and is likely going to be unique to both the condition area, but particularly to that purchaser's current setup to ensure appropriate privacy and security for their members. So I'm going to choose a de-identified file. And here you're going to see more information about these specifics enrollment file, what sorts of summary statistics we might want to see submitted, and any other criteria. And then we get to reconciliation. And this is really the last big step where we want to make sure that we can agree that we know what the measurement period is. As I said again here, we're recommending 6 months. That we ensure we understand what the bonus payments are going to be and any other criteria for reconciliation. And then last but not least is duration of the contract and renewal. So we need to know how long the contract is going to be that we're signing on and how we're going to negotiate a renewal. And with that, once you've selected everything, you come to this summary page where you can review all of the responses, and you can also, that you selected, this is your data, and if you change your mind, you can go back and edit and make any adjustments that you might need based on the selections. At the end of all of that, you can generate a PDF that will summarize all of your selections, plus some of the additional tips and context that are included here that you might need to share this information. Or, as I mentioned earlier, you can always download the toolkit to see the full set of options and considerations that PHTI recommends. And of course, I encourage each of you to browse some of the other condition areas that you see here and explore on your own. So with that, I'm going to stop my share. And I will just wrap us up and say that I want to thank everybody for attending. We have been really excited over the course of this project to hear the dialogue go from performance-based contracting as something that felt aspirational to many to something that feels concrete and real. Obviously, folks that have been following the news have seen that while this has been a hot topic in the commercial market with employers and payers, we've also recently seen the government adopting very similar models in the CMMI access model for traditional Medicare, where in expanding coverage for digital health solutions, CMS is also saying that they want to tie payment to outcomes. And so all signs point to performance-based contracting really being the future of how payment is going to be executed in this market. And we really hope that these tools and resources are useful to all of you, not only to make those interactions and negotiations easier, but really to drive towards higher performance, better evidence-driven digital health solutions. And I think the data that comes out of these contracts and out of these tools is going to continue to strengthen the evidence base and help all of us drive towards higher value innovation. So we couldn't be more excited to launch this into the world. And if you have any questions, we saw lots in the chat, so we'll try to follow up with you. This is our contact information. You can always reach us there. And otherwise, I'm going to say thank you for joining us. Share your feedback, and I hope you have a wonderful day. Thanks so much.